So in terms of the agenda for today, really, the aim of the webinar is to support you to improve uptake of the flu vaccine in health and care workers this flu season. I'll be talking a little bit about the flu activity and uptake, a bit about the importance of the flu vaccine in health and care workers, and also the flu vaccines that will be available. Dr. James Gilroy, who's one of the specialist registrars, attached to the National Flu Steering Group, will be giving a bit of the summary of the research findings, and what we're doing to try and improve uptake as well. Dr. Alice Quinn, who's a senior medical officer in the National Immunisation Office, will be giving you a little bit of an insight into how to talk to people about vaccines, particularly if they're hesitant about vaccines, and giving you some tips and, to kind of follow on that particular topic. And then finally, I'll be just talking a little bit about the frequently asked questions that healthcare workers have, and to kind of give you the information to be able to answer those questions, and also point you to some further resources as vaccinators or as flu leads or as managers indeed, to help you with this. So just as a bit of a background, so my name is Dr. Aparna Keegan. I'm one of the consultants in public health medicine within the National Immunisation Office, and I also manage the flu program here. So I'm really happy to be able to share this information with you, because one of the key priority groups for this season is trying to improve the uptake in health and care workers. So just to begin with, really just to talk about the flu activity in the past season. So there was over 16,000 laboratory confirmed cases of flu that were notified to HBSE. There was over 4,600 cases admitted into hospital overall in Ireland last flu season, and around 185 cases admitted into critical care. Particularly, the highest rates were in those aged 65 and over, unsurprisingly. And unfortunately, there was also 198 deaths, related to flu that were reported to HBSE as well. What was really complicated last flu season was that it was a multi-pathogen winter, I suppose. So we had both flu, RSV, COVID-19 circulating. There was also cases of group A strep as well. So it was a really complicated winter last season. So it's really important that we do for our winter preparedness, that we increase uptake of the flu and also the COVID-19 vaccine for our health and care workers this autumn winter. This is a bit of a graph showing in terms of the trends of the flu cases in last season compared to the previous season. As you can see, we had a slightly earlier season as well, and the peak was earlier than when compared to the previous seasons as well. And this is very in keeping with the flu activity, I suppose, that we saw in Europe last season as well. So there was a marked return to flu activity to almost pre-pandemic levels in most of the countries in Europe. And the season was again characterized by an earlier start of the seasonal epidemic and an earlier peak in positivity compared to the previous 4 seasons as well. Just to look at a little bit about uptake rates. So this shows the uptake rates over the last few years, I suppose, pre-pandemic, and the line in red shows when the peer vaccination program really kind of came into effect, and the dotted line shows the increase in uptake that we've seen in health and care workers in terms of the flu vaccine uptake pre-pandemic over the course of time, particularly the impact that the peer vaccination program has had. So pre-pandemic, I suppose, we had uptake rates in public hospitals and healthcare workers was coming in just shy of 60% there. Similarly, in long-term care facilities, the data from HBSE shows again with the peer vaccination program, you're seeing quite a good increase in uptake over the last few seasons, particularly considering where we started off with uptake levels pre-pandemic coming in just shy of 50% there. So more recently, I suppose, looking at the point prevalence survey that HBSE do with regards to trying to ascertain the healthcare worker uptake, just to note that the uptake target really from a WHO level and from a HSE level, what we have is 75% uptake. So we're trying to get to that uptake level. You'll notice that obviously during the pandemic in 2020-2021 season, uptake was, increased quite a bit to 71%, and we've seen that actually falling off over the last few seasons to 2023, which was last season, coming up to 54% in the hospitals. And again, a similar trend, I suppose, you're noticing in the long-term care facility staff as well. So it was 66% in 2020, 2021. Last season, it was around 53% in the HSE facilities there. So why are we holding this webinar? Why is it so important that health and care workers get vaccinated with the flu vaccine this season? So just remember that 75% of people with flu will have no symptoms, but that doesn't mean they can't transmit the infection. They can actually transmit infection even if they are asymptomatics. What this means is that health and care workers can spread infection even when they have no symptoms. And also remember that health and care staff are up to 10 times more likely to get flu compared to the general population, and around a fifth of healthcare workers are infected with flu each season, and many continue work despite being ill, which increases the risk of spread to flu to their colleagues and also to their patients. And when patients are hospitalized in general, they're 5 to 35 times more likely to acquire flu if they're exposed to infected patients or healthcare workers. And it's also been shown that in organizations where there's high level of health and care worker immunization in Europe, there's been shown to be reduced rates of influenza-like illness, hospitalization, and even deaths from flu, particularly in elderly, and also a reduction in health and care worker sick leave as well. So really important in terms of both both protecting our patients, but also in terms of our organizational resilience this winter as well. Similarly, in terms of if you look at the impact of flu in long-term care facilities, flu outbreaks occur each season in long-term care facilities, and these outbreaks pose a really significant threat to health, particularly to the vulnerable, such as older adults and people living with chronic conditions. And it's not unsurprising that people aged 65 and over are at the highest risk of hospitalization and complications from flu, and 80 to 90% of reported deaths from flu occur in the elderly, particularly due to secondary bacterial pneumonia, but also exacerbations of underlying disease, for example, if they have COPD or cardiac disease. And staff absences due to illness can also place pressure on these facilities as well in terms of maintaining safe staffing levels during the winter. So who should get vaccinated? And I think it's really important to remember that everyone working in a health and care setting is eligible to get the free HSE flu vaccine. And this includes medical, nursing, and allied health professionals. It also includes students who are medical, nursing, or allied health professionals. And it also includes those who within these settings who are working in residential and disability services as well. General support staff who are working in health and care settings, dental personnel, hospital porters and cleaners, ambulance personnel, carers and home help, all GP and pharmacy staff, and also agency staff who fall into the above categories. So all of these categories, really, everyone working in a health and care setting should be vaccinated with the flu vaccine if they're eligible. So just to kind of move on really in terms of the operational pathway, so where can health and care workers get the flu vaccine this season? So if they're working in a long-term residential care facilities from the 2nd of October, our COVID-19 mobile teams will be offering the flu vaccine to all residents, but they'll also be offering the flu vaccine opportunistically to health and care workers who are in these settings as well. They can also, health and care workers in long-term care facilities can also get the flu vaccine through their local peer vaccination service if it's being run there. They can also access it through the GPs and pharmacies as well. So really important that we know and we're able to signpost our health and care workers to the appropriate area to get their flu vaccine this season. Remember that, in terms of the HSE sites in particular, we do have a very strong peer vaccination program running in the community and also in the acute hospitals, where they'll be offering the flu vaccine to health and care workers in their workplace. So really important method of access, really. And in terms of where possible, health and care workers should also be enabled access to COVID-19 vaccines together with their flu vaccine. So that's, if it's possible in that area, that should be done and facilitated. And where local areas wish to provide both the COVID-19 booster clinics and flu vaccine clinics jointly, in their healthcare setting or in a local base, this is really under the remit of local governors. So it can vary from place to place, and just have a chat with your flu leads or your local managers, and they'll be able to tell you where these clinics will be. And obviously, remember that primary care is a critical pathway for flu vaccine administration. So, for example, last season, over 1.24 million flu vaccines were administered, and over 63% of these were in general practice, and 29% were in pharmacies. So, really important source. And health and care workers, together with the other eligible cohorts, can get their flu vaccine in primary care if they're not able to access it at their workplace. So, really important avenue for health and care workers this season. So just in terms of really quickly about the flu vaccines that will be available this season. So we've got only 2 vaccines that are available to keep it really nice and simple for everyone. So we've got Influvac Tetra and we've got Fluenz Tetra. Influvac Tetra is our injectable flu vaccine. It's a non-live quadrivalent influenza vaccine, or QIV. It's cultured in fertilized hen's egg. It comes in a pre-filled syringe for intramuscular injection. It's licensed from use from 6 months of age onwards. It's manufactured by Mylan. And it has a shelf life of 1 year until the end of the season, which is expiry date will be in June. And then we have Fluenz Tetra, which is a LAIV, which is a live attenuated influenza vaccine. This is produced in virus cells and cultured in hen's eggs. It comes as a nasal spray suspension, again pre-filled. This is licensed for use in children aged 2 to 17 years old. It's manufactured by AstraZeneca. And again, the storage for this is again 2 to 8 degrees. It has a much shorter shelf life of 18 weeks for manufacturing. As with any vaccine that you'd be administering, you'd always check the expiry date before administering it to the client. So Influvac Tetra will be the vaccine that you'll be using for health and care workers, because more than likely they'll be aged 18 years and over. So that's the injectable flu vaccine and that you have there. So just to kind of go into a bit more detail about this particular flu vaccine, as I mentioned, it's licensed from use from 6 months of age onwards. It comes as a suspension for injection in pre-filled syringes. It comes in boxes of 10. The vaccine should reach room temperature before use, shake before use, inspect it visually before administration, and there shouldn't be any foreign particles in the suspension. The vaccine after shaking is a colorless liquid. The dose is 0.5 mils. And it should be given into the deltoid muscle for your health and care workers who are aged obviously 18 and over. In terms of the dose of the QIV, so most people will actually just need 1 dose each season. There's a couple of people, I suppose, who might require 2 doses 4 weeks apart. So that would be, children under the age of 9 require 2 doses 4 weeks apart if they're receiving the flu vaccine for the first time or your history is unknown. Those who've had a stem cell transplant, organ transplant, they require 2 doses 4 weeks apart if they're receiving the vaccine for the first time post-transplant, and cancer patients who receive the vaccine while on chemotherapy and who complete the treatment in the same season, they require 2 doses. And the second dose is at least 4 weeks after completion of chemotherapy, or at least 4 weeks after the first dose. But as I said, most people require only 1 dose per season. Just to kind of lightly touch upon the contraindications, I think most of you will be familiar with this. It's very similar to the previous season, but really important to remember. Contraindications obviously include anaphylaxis following a previous dose of the flu vaccine or any of its constituents. Look at the SMPC, or the summary of product characteristics as it's called, for the full list of ingredients within the Influvac Tetra. Those with severe neutropenia shouldn't be receiving any of the flu vaccine to avoid an acute vaccine-related febrile illness. However, this doesn't apply to those with primary autoimmune neutropenia who can get the flu vaccine unless there are obviously other contraindications. Patients on combination checkpoint inhibitors shouldn't receive any flu vaccine because of the potential association with immune-related adverse reactions. A couple of precautions associated with the QIV vaccine. Vaccination should be deferred until recovery if they've got acute severe febrile illness. And also remember, if the flu vaccine is recommended for children aged 12 months to 23 months of age, it should be separated from the PCV vaccine by at least 1 week due to the increased risk of febrile convulsions. But obviously this is more for the children, whereas we're talking more about the adults and healthcare workers here. In terms of egg allergy, this is again a very common question that comes up, but should remember that those with a confirmed egg anaphylaxis or egg allergy can be given this flu vaccine in a primary care or school setting, with the exception of those who required admission to an ICU for a previous severe anaphylaxis to egg. So those requiring non-live flu vaccine who've had a previous admission to ICU for a severe anaphylaxis to egg should be referred for specialist assessment with regards to the vaccine administration in hospital. In terms of post-vaccination advice, just remember that vaccine recipients should be observed for at least 15 minutes after vaccination. If this is impractical, they should at least wait in the vicinity for 15 minutes as per NIAC advice. And there should be the availability of protocols, equipment and drugs necessary for the management of anaphylaxis, which should be checked before each vaccination session. In terms of post-vaccination advice, remember to let them know that if there are any adverse reactions that they noted after vaccination, they should be reported to the HPRA. They can do that themselves, or the healthcare worker can do that for them. And it can take about 2 weeks after vaccination to have protection against flu. But even after vaccination, there's a chance they might still get flu. So it's important to follow healthcare advice, public health advice, sorry. So I'll just hand over, if it's okay, to James to just go through the next section around the research findings. Thanks, James.
Thanks, Aparna. Are those slides sharing okay there? Or not? Is it sharing there now, hopefully?
They're just coming through, I think. Yes, they're coming through now.
Perfect. Thanks, Aparna. So as Aparna said, we're just going to go through some of the research that's been undertaken in the past year or so to help us understand a bit more about healthcare worker and taking up the vaccine offer of flu vaccine and things that might sort of affect that response. So as we've said, so as some of you might have seen last year, this was research that was undertaken at the start of last season on behalf of the HSE by Core Research, and it looked at flu vaccine practices in healthcare workers. If you look at the sort of behaviour of taking up a flu vaccine offer, it seemed to be a product of factors across 3 domains. So the motivation had to be there, and things that affected the motivation were noted to be a desire to protect yourself or your family, and particularly if somebody at home is at risk. There was a sense of professional responsibility, and then there was also recognition of the added work that comes from managing a flu outbreak if there's a low level of flu vaccination. Then you need to have the ability, and that in this setting refers to the ease of access to a flu vaccine, and that's a key enabler. And then you also have to have a trigger to bring about that behaviour. And some things that act as triggers for healthcare workers accessing vaccination include an established habit. We know that people who have received a flu vaccine in previous seasons are more likely to receive it in future seasons. But also social proof was important. So this is the idea that when people see their colleagues getting the flu vaccine, they can tend to be more likely to get it themselves. So these 3 things come together to form a behaviour of potentially taking up the flu vaccine. We also looked at some of the barriers to accessing the flu vaccine, and there were a few things here. So a person's culture of origin might have a bearing on their vaccination beliefs and their vaccination practices. There is very much a fear among some people of vaccines, including anxiety about adverse effects, the safety and effectiveness of the vaccine. Among some healthcare workers, there is a perception of low personal risk, and there is a concern about accessibility of vaccine opportunities in some settings, and a lack of awareness of all of the different avenues that people have to access that vaccine for free. And then there is anxiety among some about COVID-19 and flu vaccines in the same session and receiving those both at the same time, and the effect that would have. So that was research undertaken among a panel of healthcare workers this time last year. That research has been sort of followed up with a similar set of research just recently at the end of August, looking at more broadly winter vaccinations in healthcare workers. And this year, people appear to be concerned about the impact of rising respiratory viral illnesses. As Aparna said, last winter was a challenge for the health system, health service, and the system more widely. But actually, when you dig into those concerns, the concern is less for physical health and is more for an impact on the healthcare system due to the increase in case numbers. More concern related to staff shortages due to isolation requirements, and then also the concern about the impact on your everyday life if you're having to isolate as a result of picking up COVID or flu. In a change to what we found last year, healthcare workers in this year's survey indicated that they were probably less likely to seek out both vaccines in one session because of concerns about the impact on their own well-being in the period after vaccination and having 2 on the same day. Some of the reasons for not getting winter vaccines in general were related to broadly to complacency, a lack of confidence in the vaccines, and concerns over side effects. And that's similar to what we saw from the previous year. So in total, 3 in 10 of the respondents were worried about side effects, and 2 in 10 were concerned about the vaccines making them unwell. But having said that, there was an expressed intention among the respondents that they would have that 80% were going to get the flu vaccine this season, which is encouraging. Part of the research also looked at messaging themes that resonated most strongly with healthcare workers. And this is useful for us to know as we're sort of talking to healthcare workers and understanding what it is that addresses their specific concerns. So messaging that explains, as Aparna said, that higher risk of exposure to COVID-19 and flu among healthcare workers, and the potential impact on either vulnerable service users or on the person's own family, that resonated most strongly with healthcare workers. Reinforcing the fact that the vaccines are safe and effective, but even more than that, explaining the measures behind that reinforcement that give the reassurance. So explaining why we can say that these vaccines are safe and effective was an important one. And then placing vaccination within the full range of measures that offer protection. So not sort of looking at vaccination alone, but looking at all the different other things that we can do to reduce the impact of COVID and flu, while it's still at the same time emphasizing that vaccination offers the best protection, and that resonated strongly as well. So that was some of the research that we've carried out among a panel of healthcare workers. I want to go on to just briefly describe some of the work we're doing to plan for this, or to bring about the plan for the season in 23-24 at the National Flu Steering Group. So we decided we'd do an end of season review for the 22-23 flu season, and we held a series of focus groups with the flu leads from the community and the hospital groups to sort of review the season, including the healthcare worker uptick. When we spoke to the flu leads, when compared to previous seasons, there was known to be an increased reluctance to receive the flu vaccine among some cohorts of healthcare workers. And the reasons behind that are probably multifactorial. There's probably lots of things going on, and it's different for different people, but some of the reported impressions did include people experiencing what we call vaccine fatigue after several cycles of the COVID vaccination program on top of the annual flu program. There was some persistent misconceptions around the need for flu vaccines in healthcare workers. People, as we said, had a low personal risk perception, and some people still believed that they were offered protection by a COVID-19 vaccination. Some staff in some settings did report that towards the end of the season, they were starting to feel overwhelmed by the combined messaging around COVID and flu. And that's an important moment for us to be aware of, because we have to make sure that when we're speaking about these things, that it's aligned and it makes sense, and it's not too much for people to hear at any one time. So that was important feedback. And the flu leads reported that in their settings, spending more time in specific settings, such as long-term care facilities, did allow them to speak with staff about their concerns. But that's a very time-consuming aspect of the work, and it's very labor-intensive. So following on from that lessons learned, at the end of the season, we then convened a workshop to start putting together what we called a healthcare worker flu vaccine uptake plan for 23-24, given, as Aparna said, there was concern about the trend towards lower uptake among healthcare workers. We developed a multifactorial action plan. It's designed to support the local implementation of the annual flu plans, and it had a particular focus on the increase in the healthcare worker flu vaccine uptake. When we were talking about the plan, I suppose we were very clear that locally targeted flu plans with local senior management buy-in, supported by the flu leads, are the key aspect and will continue to be the key aspect of the annual flu vaccine plan, including for the provision for healthcare workers. And whatever we derived or whatever we put together as an action plan at the National Flu Steering Group level should only support and enhance those local plans and shouldn't adversely impact on the necessary local flexibility. So, as I said, it's a multifactorial plan, but at a high level, I suppose it's an action plan that targets specific actions across a number of the components of the healthcare worker flu vaccine journey, trying to take a holistic approach and trying to improve uptake across different ways, and to make it as easy as possible for healthcare workers to access that vaccine. So some of the things we did included providing additional trusted information out there to healthcare workers prior to vaccination, and I think Aparna will speak about that briefly at the end of the additional information we have up on HSE land this season. We plan to distribute some resources to support the flu leads in the planning and evaluation of the local flu plans on an annual basis. We do plan to provide targeted support for the peer vaccinator scheme, and I'll come on to that in a second here. And we're going to continue to support the development of the ICT aspects of the annual flu plan, including through the use of COVAX. So, as I said, we had a look at sort of targeted support for the peer vaccinator program. The National Flu Steering Group sees the peer vaccinator program as a high priority for supporting the annual flu program. And so they sought some additional information on how we might better support that program, and then also on peer vaccinators' perspectives on healthcare worker flu vaccine uptake and the barriers and things that we can do to address the lower uptake. So a survey was put together and seeking to get feedback from both peer vaccinators who were active in 22-23, but also those who had been previously peer vaccinators but weren't active this year, to identify additional measures that might support the program. So we had a great response from it, and thank you to all those on the call who took the time to fill in this survey if you're a peer vaccinator. Your feedback was really valuable to us, and we'll present some of it here. What we're presenting here is mostly the findings in relation to things that might impact on healthcare worker flu vaccine uptake. There was more feedback as part of that survey, and I suppose I'll just briefly describe that at the end. But what we'll have here is the healthcare worker uptake information. So as I say, 188 responses. Of those, 162 were current and 26 were recent peer vaccinators. So we had a set of questions asking people their experience as a peer vaccinator in this flu season and their experience of the season overall. We asked them to move a slider between very positive and very negative, and where they placed that slider gave us a value between 0 and 100. And what we have here is the average response given by people. The median response was 74, so that's reasonably positive to good to very positive. And the blue box here then sort of represents the middle 50% of all the answers. So what we can say from this one is that more than 75% of, or around 75% of people ranked their experience of acting as a peer vaccinator in the season on the positive end of the scale, which is reassuring that our peer vaccinators felt positive about the season. We then asked them to think about their experience of encouraging their peers to access flu vaccine this season, and when they compared it to previous seasons, was it much more challenging or much less challenging? Where a score of 0 would have been much more challenging and a score of 100 would have been much less challenging. You can see then from this red line that overall, in general, it was more towards the more challenging end of the spectrum of answers. So an average answer of about 38, and the bulk of those answers in the 50% range were less than 50. So in general, the peer vaccinators experienced as a more challenging season to encourage peers to access their flu vaccines. And again, then when compared with previous flu seasons, in this season, did you feel like your peers were more or less open to flu vaccine? And again, here 0 would be less open and 100 is more open. And so definitely there was a tendency towards people being less open in the experience of the peer vaccinators this season, with an average or median of 33. And then I suppose 75% of the results were on the less open end of the spectrum. So that sort of tallies up with what we've heard from the flu leads, and it tallies up with what we've seen. But I suppose it is concerning that there appears to be less of an openness to flu vaccination through the experience of the peer vaccinators. We did ask then about the peer vaccinators in their own role, and this is reassuring data as well. We said, how important do you feel that the peer vaccinator role is to the annual flu plan? Because we, the National Flu Steering Group and the HSE would view the peer vaccinator role as very important, and thankfully the peer vaccinators also saw it as very important with average scores of 90 and 91. And as you hopefully would expect, peer vaccinators viewed the annual flu vaccine as very important for healthcare workers. So that's some of the data on how the peer vaccinators experienced the survey. We also gave a bit of space to do some free text responses in relation to barriers that reduce healthcare worker flu vaccine uptake. And we had 117 free text responses, and people really took a bit of time to give us very good feedback here on things that they'd experienced. And so we want to just report back on some of those. So vaccine fatigue, as we mentioned at the start, came up in a big way among peer vaccinators from their experience with healthcare workers. And a number of people described it actually as vaccine burnout, which I thought was quite a good phrase. And it's concerning that it's such a strong response. So 46 of 117 free text responses were specifically about vaccine fatigue. So I think that is a real thing out there, and how we address that is a challenge, but it's important to be aware that people are feeling vaccine fatigue or even vaccine burnout. There does remain a persistent perception among healthcare workers that flu vaccine poses a low personal risk. And the peer vaccinators highlighted that a number of staff didn't seem to take account of the risk of flu to themselves and their families and their service users. There was some concern about accessibility to flu vaccination opportunities and how that might impact on people taking up the vaccine. And that was either due to work pressures, meaning people couldn't be released from clinical settings to attend the vaccination, or to a requirement to travel off-site to a vaccination opportunity. And again, the message wasn't getting through to some people about the different avenues that Aparna mentioned there about accessibility to flu vaccines. So one of the things in our messaging is to make sure that people are aware that there is lots of different ways you can get the flu vaccine, and everywhere that they get it as a healthcare worker, if they're eligible, is free. And so we seek to address that and how we communicate as well. There were a group of themes related to concerns about vaccine safety and vaccine effectiveness, and this included sort of fear of side effects, a fear of the vaccine causing flu, a concern that the vaccine wouldn't prevent flu, and the safety of taking multiple vaccines at the same time, and then misinformation about vaccines generally. And I suppose it's important to recognise that makes it a challenging thing for the peer vaccinator role. It's hard to deal with your peers sort of bringing this level of concern to you. So I suppose we're grateful to the peer vaccinators for what it is they do, but also grateful for their feedback in terms of this particular challenging aspect of their role. And I suppose we try as much as we can to support that aspect of their role. Peer vaccinators themselves, I suppose, highlighted that more education around the flu vaccine may help. And again, that's been fed into our plan for the HSE land resources at the start of the season. So that's I suppose, a whistle stop tour around some of the research and some of the work going on at the National Flu Steering Group, just to sort of highlight that within that peer vaccination survey, we did receive and did seek a lot of other feedback on practical aspects of the programme. And it's just to reassure those people that filled in the survey that feedback has been heard and it's been put into our planning process for 23-24 at multiple levels within the National Flu Steering Group. And so again, thank you for filling that in. Thank you to the flu leads for circulating it. And a special thanks to Leanne Kane in the National Immunisation Office for facilitating that survey. I think we'll pass on to Alice now, who's going to talk to us about sort of speaking to healthcare workers about flu vaccine.
Okay, thank you, James, for that introduction. And I'm just checking that it's shared there. And, so you can see that there now, can you?
We can, Alice, thank you.
Okay. So I'm going to talk about vaccine hesitancy, and I just want to thank Dr. Ruth Kiant, who's an SPR in public health, for these slides. So what is vaccine hesitancy? Well, the World Health Organization defines vaccine hesitancy as a delay in acceptance or refusal of vaccination despite the availability of vaccine services. It is a dynamic, complex, and context-specific issue varying across time, place, and vaccines. It is influenced by complacency, convenience, and confidence. Why is it so important? Well, it is very important. The World Health Organization have identified vaccine hesitancy as one of the top 10 global threats to health. And as vaccine hesitancy increases, the vaccine uptake can decrease, and this can impact on the re-emergence of infectious diseases that have been kept at bay by vaccination. This is both a threat at individual level and also at population level for herd immunity. A recent paper from Japan demonstrates the potential tragic effect of vaccine hesitancy. The HPV vaccination campaign began in Japan in 2010 for girls aged 12 to 16, and they had an initial coverage of 70%. However, this dropped to 1% due to vaccine hesitancy related to now disproven concerns regarding the vaccine side effects, and their rates of vaccination for HPV and other vaccines have not fully recovered. This paper used modelling to estimate the rates of cancer and death, and the vaccine crisis from 2013 to 2019 is predicted to have resulted in an additional 24,600 to 27,300 cases and 5,000 to 5,700 deaths over the lifetime of the cohort formed between 1994 and 2017. Compared with if the coverage had remained at about 70% since 2013. And I think this study is worth having a look at because it highlights the fragility of any immunisation system's confidence. Complacency is defined as when people are not particularly worried about the risks and are not aware of the level of risks. They perceive the risk to be low, and they're complacent about it. It won't affect me. We live in a safe part of the world. My children don't need a measles vaccine. Sure, there's no measles here. Vaccination is not seen as a high priority compared to life's other competing interests. Convenience is defined as when the logistics of getting the vaccine outweighs the perceived benefits of the person. They see it as difficult access. It might involve time off work, travelling to a clinic, or a language barrier. The person believes that it's just too inconvenient to get the vaccine, not weighing up how inconvenient it might be to get the disease. And confidence is perhaps the most complex factor and the most relevant following the COVID-19 pandemic. A person may lack confidence that the vaccine is safe, effective, or necessary. Getting a vaccine involves a big leap of faith in some ways. It involves trust in many different people, institutions, and factors. Getting a vaccine involves trust and confidence in the policymakers, the politicians, the government, your health system, your healthcare worker, doctor, nurse, or pharmacist, your scientists and experts, health professionals in general, and mainstream media sometimes, and as well yourself. Do I know who to trust? Do I know what resources are reliable? Do I know how to make sense of all the information available, to name but a few? When you think about it in this way, it is understandable that some people are vaccine hesitant and that it has become more prevalent now in the age of mass media, the internet, and social media. Navigating the online world and the scientific evidence is difficult, and most education systems do not teach critical thinking skills or scientific reasoning, and perhaps they should. What influences a person's decision to get a vaccination is very complex, and multiple influences act on a person to make them decide to get a vaccine and not. And as you will see them listed here, religious and moral convictions, public health and vaccine policy, subjective norms, risk perception and trust, communication and media, knowledge, perceived importance of vaccinations, past experience, and most importantly for the audience here, a health professional's recommendation. And that is something you can do to increase uptake either in your co-workers, your employees, and in your friends who you work with. What influences a person's decision to vaccinate? Well, data, evidence, and science plays a part, but in reality, people are influenced by other factors too, such as anecdotal evidence, lived experience, and emotions. None of us are completely rational beings. We tend to see what we believe rather than believing what we see. Taking all this into account, how we deliver our message is just as important as what these messages are. And it's important to kind of signpost people to information that is reliable. So we have HSE information packs and websites, the NIO information, and then information from general practitioners and practice nurses by word of mouth or from work colleagues, from family, friends, and spouses and partners, and then what we hear broadcast and internet and internal emails, and then importantly for this audience again, from occupational health, from line managers, from flu champions, and from peer vaccinators. And there is also other information from media, TV, internet, and social media. Is vaccine hesitancy increasing? Yes, it is. As James just described there, this is due to a number of factors, including a culture of decreased trust in experts, the rise of internet and social media, a rise in belief-based extremism, wider dissemination of belief-based extremism, political polarization, libertarian views, alternative healthcare advocacy, bad science, as we saw with the mRNA vaccine and autism, and many new vaccines coming on stream, and parents concerned of overloading their infants. The focus on vaccines and their safety during the COVID-19 pandemic as well, both good and bad. So when you're talking to, as a healthcare worker, talking to somebody about the flu vaccine, whether it's a co-worker or an employee or a patient, you want to identify where they lie in terms of the spectrum of vaccine hesitancy. So on two polar ends, we have those who refuse all in red, I don't trust vaccines, and those who accept, I'm ready to get the vaccine. And in between, we have a vaccine hesitant group. So they might be refusing but unsure and say things like, I don't think I'll get it, I'm not sure about its safety, or accept some or delay or refuse some, I don't know, I have doubts. Accept but unsure, I think I'll get the vaccine, but I have some questions. And we use an approach called motivational interviewing to move people from these mixed feelings and move them towards a health behaviour change that's consistent with their values and their needs. And I'm just going to go on to talk about it in a little bit more detail in a few minutes. So for those who refuse all, how do you proceed? Well, obviously, you're not going to make a lot of progress with them. The most important thing is not to enter into a debate and focus on their concerns. So just focus on their concerns, be non-judgmental, and ask their permission before you start to discuss the vaccines, and acknowledge their strong feelings. Leave space for any future discussions, and at all times maintain a professional relationship. So for those with the hesitant and undecided, as I have just said, you want to have a skilled conversation that is both collaborative and person-centered, and use a participatory approach such as motivational interviewing. For those that accept all, you're going to offer positive encouragement and encourage them to proceed to vaccination. What can you do to increase flu uptake? Well, people trust healthcare workers, so your recommendation is important. Vaccine decisions are based on many factors, including emotion. The way we talk to patients matter, the message we deliver matters, how you say it matters as much as what you say. You need a clear, concise, and easy to understand information with no jargon, and address their genuine concerns, and use motivational interviewing. So what can we do to increase uptake? Well, reminding people about vaccinations has been shown to increase uptake. Make appointment times convenient. Make the location as accessible to the person as you can, such as in their workplace, which, as James said, this also creates a norm for having the vaccine in your workplace, providing it in your workplace. Also make them aware of the pharmacy and GP options, and take opportunities to recommend vaccines at all opportunities. For instance, when somebody is pregnant and visiting a doctor, or you learn that somebody is pregnant in a healthcare setting. So what is motivational interviewing about? Well, it was developed by Miller and Rolnick in 2013, so it's a relatively new therapy. And many of you may have already done training in motivational interviewing, as it's used in lots of different areas as well, not just in vaccines. And we use an acronym called OARS, which relates to open-ended questioning, affirming, reflecting, and summarizing, that you use in motivational interviewing. It's covered in a HSC Land course talking about immunisations that we will direct you to briefly, but just to summarize it, and it involves asking open-ended questions, affirming strengths and validating concerns, saying things like, it's great you're thinking about vaccines, it's natural to worry about doing the right thing for you in terms of flu vaccines. So ask, provide, verify, ask what they understand, provide information, and verify what their understanding is now. Reflect the information back that the person has given you of their understanding, what they have said, and what you think they mean, and respond to any concerns raised, and summarize and describe an action at the end of the consultation or the discussion, summarizing the discussion and the next action. So if somebody is undecided about a vaccination, again, in that group that we described, the three groups that we described earlier, you need to be respectful and open in the use of motivational interviewing, and ask open-ended questions such as, can I ask you what you're worried about? Affirm their strengths with statements such as, it's good that you're looking for information about the vaccine. Acknowledge and validate their concerns. It can be worrying when you read things like this online. Reflect and respond. So saying something like, I understand that you want to do the best for yourself in terms of flu vaccines, but that you have some concerns about X. Ask, provide, and verify. So you'll say something like, can I ask you what you know about flu vaccine? Can I share with you some information? Now we have a chance to talk. How do you feel about the flu vaccine? Address their specific concerns. So you're not going to bring up any new concerns, and you're going to summarize and describe the action. you decided to get the flu vaccine. You're going to register on the online portal or go to your hospital flu clinic or get it in the GP and pharmacy. And it's also important to point to other sources of information and leave the door open for people to come back. So it's also important as a healthcare worker to share your experience, if relevant, such as I get the flu vaccine each year. And I have done motivational interviewing training, not specifically for vaccinations, but it is a very useful toolbox to have to move people in the right direction in terms of health behaviours, and it is worth doing the training that I'm going to describe to you in a few minutes. So if somebody is in the refusal, like as I said before, you just be non-judgmental with them, you just acknowledge their feelings. I can see that you feel strongly about this and that you want to do the best for your health. Ask permission to discuss. Would it be okay with you to talk about flu vaccinations? If they agree, offer information and focus on their specific concerns. Can I ask what your concerns are about the flu vaccine? Do not enter into debate or argument. I can see you feel strongly about this, and leave space for future discussions. Please know that if you ever want to talk about vaccination, you're welcome to come back and talk to me, and maintain the relationship with the patient so the door remains open. And when I did my motivational interviewing training, three of us role played this and used questions such as these, and one person observed, one person was an actor, and one person was the person giving advice as a healthcare worker. And it's quite a useful thing to do. You do need to kind of memorize these questions or be aware of the questions and be able to kind of pull them out as a toolbox when you need them as a peer vaccinator or as a person recommending the vaccine. So just be curious as well with motivational interviewing. It's about being curious about the patient and why they have this opinion. And I've taken this from the CDC guidance on motivational interviewing. So it's more about focusing on why they would get vaccinated than why they wouldn't get vaccinated. And they have this piece where they ask the patient a scale question. For example, on a scale of 1 to 10, how likely are you to get the COVID vaccine? 1 is never, 10 is already have an appointment. And then you explore both sides of whatever number is given. So for example, let's assume someone says 4. This is where the curiosity comes into motivational interviewing. You can say, okay, why 4? And why not a lower number? And let them answer and ask a follow-up question. What would move you from a 5 to 6? Or explore, why they've had a vaccination in the past. So these are the resources that are available to you on hesitancy about vaccination, very useful for your peer vaccinators or anybody involved in vaccination. So first of all, the National Immunisation Office has the HSE Land module talking about immunisations. Dr. Chantal Mingoni has formulated this presentation and it's very good. We also have the NIO Lunch and Learn addressing vaccine hesitancy and communicating about vaccines, which happened earlier on in the year. And Dr. Ruth Kant presented this presentation. And I'm also referencing the World Health Organization training on a module for healthcare workers, and also the CDC one talking to patients about COVID-19 vaccines, but obviously any motivational interviewing skills apply to any vaccines. It's the same for any vaccines. So that's the end of my presentation there. And I'm just handing you back to Dr. Aparna Keegan.
Thank you, Alice, for that informative presentation. So I'm just going to take over for a second and just go through a couple of frequently asked questions that you may get from health and care workers and how you might respond to them. So just to give you a few things to kind of keep in the back of your mind if you're asked a few questions. So I suppose just to kind of summarize really some of the things that James really talked about, what health and care workers are worried about in terms of vaccine safety peers, around the perception of low direct risk from infection, which we talked about earlier in my presentation presentation at the start around how important it is to get vaccinated because they are at risk in terms of health and care workers due to the nature of their work. But the other concerns around low perceived effectiveness, I'll talk about in a second, and around the hesitation around getting a double dose, particularly in regards to co-administration of flu and COVID this season. So first bit I just wanted to kind of touch on is when people talk to you about, how effective is the vaccine? So it's just important to tell people that, it is an annual flu vaccination campaign, so you need to get it every flu season. And the reason for that is that flu viruses are constantly changing and immunity from the vaccination declines over time. So it's really important they top up, as we're calling it this winter, with the flu and COVID-19 vaccines. So in terms of the flu vaccine, itself, each year the flu vaccine is made 6 months ahead of time based on the WHO recommendations on, what are the flu vaccines expected to circulate. 9 out of 10 years is, there's a very good match on the circulating strains. And vaccine effectiveness really depends on how closely the circulating strains match to the vaccine itself. And there can be a variable protection each season based, between 40 to 90% in persons less than 65 years old. And just to kind of mention, in terms of even though the vaccine is less effective at preventing illness among 65 and older, because older adults, it may be less effective because of their immune system, but it is really effective at preventing complications and deaths. So in terms of, for example, elderly persons living in long-term care facilities, the vaccine is 50 to 60% effective at preventing hospitalization from all causes and 70 to 80% at preventing death. So really important that people get the flu vaccine, protect themselves, particularly older adults, from those serious complications of flu. In terms of the safety around the vaccine, it's important to note that we reiterate the flu vaccine is very safe. It's been given for more than 60 years to millions of people worldwide. And the injectable flu vaccine contains an inactivated virus, so it can't give you flu. And if you feel achy or slightly feverish, it's a normal reaction of the immune system to the vaccine and generally lasts around 1 or 2 days. And it's really important to let people know that most of the side effects are mild to moderate and usually are self-limiting, so they disappear within a couple of days without needing treatment. And severe side effects are extremely rare. And if people want to know more information about the adverse reactions, so the common ones, the very common ones at the local adverse reactions include injection site pain and swelling. The more general ones around fever, fatigue, myalgia, and irritability in young children is common. Drowsiness, sweating, and arthralgia are also common. And as I said, very rarely you might get immediate allergic reactions. And in the post-marketing surveillance, also there was very rare reports of Guillain-Barré syndrome associated with the QIV vaccine. But remember that the risk of GBS or Guillain-Barré syndrome is much greater following flu illness than following flu vaccination. And you can have as vaccinators and as managers, you can look at the full list of adverse reactions and the summary of product characteristics available on the HPRA website for Influenza Tetra as well. Another question, healthcare workers who are pregnant may ask you, should pregnant healthcare workers be vaccinated? Absolutely. So the flu vaccine is recommended for all pregnant women, and pregnant women are much more likely to get complications from flu because of changes in the heart and lung functions during pregnancy. And if they get flu, they're much more likely to need admission to hospital and even critical care as well. And getting the flu in pregnancy may also lead to, unfortunately, premature birth, lower birth weight, and even stillbirth. And there's evidence that the flu vaccine reduces the rate of stillbirth by over 50%. And also remember that after birth, the flu vaccine continues to provide protection to mother and baby for up to 6 months. And this is particularly important because infants under the age of 6 months have the highest rate of hospitalization and death from flu, and they're the one group, I suppose, we don't have a vaccine to cover them because the QIV vaccine is only licensed from 6 months of age onwards. So it's important that they're covered through the maternal vaccination. And the vaccine, remember, it can be given at any stage in pregnancy. So really important that pregnant healthcare workers are supported to make an informed choice about vaccination this winter. And in terms of co-administration, which is another important, I suppose, concern among health and care workers, it's important to let them know that NIAC recommends that the COVID-19 vaccine and the adult seasonal flu vaccine should be co-administered where possible, again, to maximize uptake. Co-administered vaccines should be given in the different arms, and vaccinees should be informed that there may be a slightly increased risk in short-term mild adverse events following co-administration with the seasonal flu vaccine. This includes pain at the site of injection, fatigue, headache, and myalgia. And as a precaution, I suppose in terms of co-administration, although it won't apply to your health and care workers, in the very young children, that's the only cohort where the COVID vaccine and any other vaccines, including flu vaccine, should be separated by 14 days as they're waiting for more data. So this is just in the 6 month to 4 year cohort. As I said, it doesn't apply to your health and care workers. So just in terms of resources, just before we finish up, most of you will be familiar with this. If you go to immunisation.ie, you'll see a plethora of information that's there to support you as vaccinators in your journey on healthcare worker vaccinations. In particular, we'd recommend that you do the HSC land module on the QIV, which gives you much more detailed clinical information on the QIV vaccine. There's also medicines protocols and training material available. As I mentioned, we had a webinar on the 4th of September, which was much more detail about the full flu vaccination program. There's also a supporting information document for HSC vaccinators that you can use. There's a whole load of FAQs there as well, and there's a couple of FAQs that I saw on the chat function that we can add to that one, so which is great to get kind of new into that repository as well. There's also consent forms there as well, but remember that all of this vaccination information should be on the COVAX system, but obviously if you need to have the as a backup the paper-based consent forms, that is available. We're also going to be releasing the toolkit and campaign assets. You'd have seen some of these last season. We're just updating them. They'll be available very shortly on our website. So this is going to be updated as we reach the launch of the flu campaign on the 2nd of October. Just to mention, this year, Ruth, who was one of our registrars before, she worked with occupational health to develop this and update this module, a HSC land module. So this is a new module for this year. This is a module to provide information for all health and care workers on the flu and COVID-19 vaccine so that they can make an informed choice about, whether to get vaccinated this autumn. So it's just to kind of give them the right information from a trusted source to make an informed decision. This is available on HSC land, so it only takes 15 minutes. So we really are encouraging you to recommend it, that your staff and your health and care workers and your colleagues to undertake this module if they need more information on their vaccination choices. Again, there's more resources that are coming on immunisation.ie. This is a bit of a snapshot of the posters and campaign assets, etc., that we have for you to support you in your vaccination campaigns. Also, just to let you know as well, so if health and care workers want information, we are just updating the webpage on our hsc.ie/flu, which is our public-facing materials. And on that, if you look on the left-hand side, we've got our I've just highlighted their flu vaccine for healthcare workers. If they click on that link, that will be live very shortly in the next few days, and health and care workers can go into that and get information about how to book for their vaccination clinics, where they can get the vaccine, more information on why it's important that they should be getting vaccinated. And if you look at the bottom link there, which is flu vaccine information material, you'll get all of this other campaign assets that are there. So more public facing, including posters, there's videos up there. So for example, Maeve was talking about vaccination in pregnancy, and we have some videos there from healthcare workers who got the flu vaccine. So again, you can use those assets there. There's also information leaflets that'll be uploaded very shortly in English and Irish. And we also have for vaccinators in terms of algorithms on which vaccine should be given to which cohorts this season as well. So lots of information, and just wanted to kind of really end with, in terms of the 3 points that we think are really important from you as local leads. So it's important to have locally developed plans, and the flu plans have been developed by the flu leads, which is really great because it does support and embed that critical function of the peer vaccination program locally and those flu vaccination drives locally. And part of that important plans is that communication plan within that. So there is funding available for this, and that's been released to your local area. So it's really important that it's a locally driven communication and it's a strong local governance and leadership on it as well. So making sure that you're looking at this data at senior management meetings in your area, and that we are providing strong messages on the importance of vaccination to staff as well, and that we're leading by example as well. And again, as I said, if it's helpful, please do support your staff to undertake the HSC land module, which is called the Flu and COVID-19 Vaccines for Healthcare Workers. Protect yourself and protect others. Really simple module to give you the right information this season. As always, I just wanted to let you know that we have our immunisation at hsc.ie website. So really important resource which healthcare professionals can use if they have any queries during their vaccination journey this season. Please do email us and we'll be very happy to answer your queries. So clinicians such as Alice and others in the team are part of that, man that particular inbox, and they'll be responding to you very quickly this season. I suppose we've reached our 1 o'clock deadline. So, and I know that Alice and myself have been answering some of the questions in the chat. If we haven't got to any, we'll respond to you directly if that's okay. And we'll add some of those to our FAQs as we go along as well. So I suppose it just leaves me to say thank you so much for attending. And I'd also like to thank our other presenters, Dr. James Gilroy and Dr. Alice Quinn, and also Leanne and Femibi for supporting us with the organisation of the webinar as well. So thank you very much, everyone.